Sesamoiditis of the foot is a fairly common condition that can cause forefoot pain. The sesamoid bones are located on the ball of the foot, just behind the big toe joint. These bones are about the size of jelly beans. Looking at the skeletal model, you can see two green arrows which are pointing to the sesamoids. The purpose of the sesamoid bones is to act as a lever system or fulcrum for the flexor tendons that bend the big toe downward. There are generally two sesamoid bones, but sometimes one bone will actually be two smaller bones and you have a condition known as bipartite sesamoids. The problem with sesamoid bones is their location. They are located directly underneath a major weight-bearing area of the foot, and for that reason are subject to pressure and trauma from just walking. Because of this pressure and trauma, sesamoid bones can be injured by issues such as the weight of the patient, the particular foot structure of the patient, activity of the patient and the types of shoes the patient is wearing. These factors can all contribute to the inflammation of the sesamoids and the ligaments that attach them to the larger first metatarsal bone. Typically, sesamoiditis symptoms range from a dull ache to a sharp pain every time the patient walks. The affected area may be swollen and slightly red. Bending the big toe upwards will generally cause the pain to worsen. The onset of symptoms of sesamoiditis can be gradual over a period of time, with eventually the pain becoming so bad the patient has to seek treatment. Conversely, a day of walking in a very dressy shoe on the streets of New York City, for example, can set off the pain so that by the next day the patient is in a great deal of pain. The area will tend to be more painful when barefoot on a hardwood or tiled floor and will feel a little bit better when walking on carpeting or in a padded shoe such as a sneaker. People who wear very thin-soled shoes and women who wear high heels will experience more pain because the thin sole does not protect the area and the lift of the foot from the high heel puts more pressure directly on the sesamoid. When there has been a large amount of stress to the sesamoids, there is also the possibility of fracturing the bone. At times it can be very difficult to make a diagnosis of a fractured sesamoid by X-ray alone, and frequently, either bone scan or MRI will be ordered to confirm the diagnosis. Treatments for sesamoiditis include conservative care, which can be a combination of anti-inflammatory medication given in regimented doses over 10 to 14 days. Sometimes strapping of the big toe joint to limit its movement upward can also protect the sesamoids and allow them to heal. Use of a cushioned inner sole can be added to the shoe to protect the sesamoid bone from ground pressure. Wearing a good solid laced shoe with a low heel and not flimsy dress shoes during the healing process will help the condition improve. Shoes for sesamoiditis should also include a rigid sole, which will keep the big toe from bending upwards. Additionally, the inner sole should have good cushioning. In more severe cases, a cortisone injection may be helpful for sesamoiditis, but not for a sesamoid fracture. Application of an off-weight-bearing cast or use of crutches in an effort to keep the pressure off the sesamoids can also be helpful in situations where other treatments have failed. Lastly, physical therapy for sesamoiditis can be very helpful as an adjunct treatment. In the case of fractured sesamoids, at the minimum, the patient needs to be in a cast for at least 4 weeks. In severe cases of sesamoiditis where conservative treatments have failed, there are more aggressive treatments available. At times, the offending sesamoid can be removed surgically. However, that creates a multitude of potential problems. Since the bones are embedded in the tendons that help the big toe move, removing a sesamoid can adversely affect the function of the tendon and can cause the big toe to drift either towards the second toe or away from the second toe, thus creating instability in the great toe joint. If the problem is a bipartite sesamoid, particularly the sesamoid on the inside part of the foot, it can be shaved down without totally removing it. People who are prone to sesamoiditis have to be sensible in their approach to shoe selection and activities. If you're going to insist on wearing shoes that exacerbate the problem, all the therapy in the world will not remedy the issue. The same is true for those who may participate in an activity that forces the foot to excessively bend at the big toe joint. An example would be someone who has to stoop down, bending the ball of the foot excessively, such as in gardening. These people must wear shoes that will cushion and protect that part of the ball of the foot. Many times, an orthotic can be prescribed to counter the forces that are causing the pain. Orthotics for sesamoiditis will often include what is known as a dancer's pad, which is a cushion that is built into the orthotic around the affected sesamoid in an effort to keep the sesamoid from hitting the ground. If you are suffering from this type of pain, a visit to a local podiatrist would be in order.